Welcome to the NLM Discover session. Today we welcome back Christian Minter, who is now full-time at the University of Nebraska Medical Center, Mcgoogan Library, and she is here to discuss Informed is Best, health information resources to support breastfeeding families.
Thank you, Annette. A lot of my work focuses on what we call consumer health resources, or resources that have been created specifically for patients and families and the general public. Now, I am not a lactation specialist, but I do have a strong interest in pregnancy, childbirth, and breastfeeding, and I try to keep up with the latest research and evidence-based information. So I'm a big proponent of patients, families, and their health providers having access to adequate information to make well-informed healthcare decisions. And unfortunately, there is still a lot of misinformation and misconceptions about the benefits of breastfeeding, how breastfeeding works, and how to address challenges, who to turn to when you need help. So it's important for families to have all the facts and facts that are based on science in order to make the decision on whether or not to breastfeed. And for those that do breastfeed, how to best successfully meet their breastfeeding goals, whatever those goals may be. So we're here in August in National Breastfeeding Month. So this is a great opportunity to advocate and educate on breastfeeding topics. So my objective for this webinar is that by the end of the session, you'll be able to list at least 3 benefits of breastfeeding, and benefits not just for mom and baby, but for the community as a whole, and that you walk away being able to remember at least 3 of those benefits, and that you can identify at least 3 resources that will be useful for you to support breastfeeding families in your community. So first, let's talk about breastfeeding in the context of public health. Breast milk is the best food for infants. This is not a judgment against those who cannot breastfeed or choose not to breastfeed. No one should be made to feel superior or inferior based on whether or not they breastfeed or formula feed. However, we do have to present the facts. Breast milk is specifically made for human babies. The proteins, calcium, and iron in breast milk are more easily absorbed. There are also unique living cells, antibodies, enzymes, and hormones in breast milk that haven't been replicated artificially, and they enable the breast milk to adjust to meet the changing nutrition and health needs of babies. The benefits of breastfeeding continue for as long as baby or toddler is fed. The American Academy of Pediatrics recommends breastfeeding exclusively for 6 months, and that means that for the first 6 months, breast milk is the only thing that infants receive, so no juice, water, or other foods. And then they recommend continuing to breastfeed for at least 12 months or longer. The World Health Organization also agrees for exclusive breastfeeding for 6 months, and they encourage breastfeeding for at least 2 years, or as long as mother and baby desire. So those benefits continue whether the baby is breastfed for 3 days, 3 months, or 3 years. For babies, it reduces the risk of ear infections, colds, diarrhea, pneumonia. Any amount of breastfeeding compared to exclusive formula feeding is helpful. The babies that are exclusively breastfed during those first 6 months receive the most benefit. So, for example, with ear infections, a study found that babies who receive any amount of breast milk compared to those who are only formula fed can see a 23% reduction in risk of ear infection. However, babies who were exclusively breastfed for more than 3 months saw a 50% reduction in risk. There are also health benefits for mothers, too. The hormone oxytocin that's released during breastfeeding helps the uterus contract and return to a normal size more quickly. It also helps to reduce post-delivery blood loss. Breastfeeding also lowers the risk of breast and ovarian cancers and heart disease issues like hypertension. And also rheumatoid arthritis. So similar to babies, the longer a mother breastfeeds, the greater reduction in risk. Mothers who breastfeed a year or longer see the most health benefits. This is important because chronic conditions like type 2 diabetes, heart disease, and cancer are a big problem in the U.S. right now. So that's why we consider breastfeeding to be a public health issue, because the benefits to both mother and baby are really big, and they have a huge impact on mortality, infant mortality, and reducing the burden of chronic illness in the society as a whole. So there's also benefits for society. So aside from the individual benefits for mother and baby, there are also benefits for the economy. When there's a reduction in the childhood illnesses and chronic diseases, this leads to having a healthier community. Healthy people mean less sick leave is used and more productivity at work. So you're saving money with fewer health insurance claims. People who are working take less time off work. And it also saves money because families are not spending as much money on formula. And the benefits to the environment, breast milk is a natural, renewable food. So it contributes to living green. It doesn't cause waste. So the packaging and the pollution that's caused with transporting formula between manufacturers to stores, you don't have that when you're using breast milk. So it definitely benefits the environment as well. The Healthy People 2020 goals are public health goals that we've set certain benchmarks. We know what the baselines are, and then we set certain goals for improving different aspects of public health. And so some of those goals relate to breastfeeding. So increasing the number of babies that start breastfeeding and the number that continue to breastfeed over the first year. So the rates have been rising overall, but there are still differences and disparities based on zip codes and race ethnicity. For example, I have here on the screen the very top level are the current rates as of 2016 for babies that were ever breastfed, that were still breastfeeding at 6 months, breastfeeding at 12 months, the percentage that were exclusively breastfeeding at 3 months, and exclusively breastfeeding at 6 months. So we see right now the national average is the national rate is 81.1%. Under that, I have the 6 states here in the mid-continental region. You can see here in the mid-continental, the rates are pretty high. Most of our states, we have between 80% to 94.4% of babies, depending on which state you live in, are ever breastfed. And that just means that even if they just have breast milk the first day, they're still counted in that number. So you can see, like, for instance, in Nebraska, the state rate is 80.8% compared to Utah, which is like 94.4% for those ever breastfed. And then when you start looking at 6 months and 12 months and those who are exclusively breastfed, you'll see that the numbers start to drop. And then also if you're comparing our region, some other states further down south, like Mississippi, there's only a 52% initiation rate of breastfeeding, and Louisiana has a 60%. There's a big difference. There are also significant differences between race and ethnic groups. For example, African American and Native American families are breastfeeding at lower rates than white and Latino families. It is important to recognize that breastfeeding is happening within all ethnic groups. Sometimes the focus is just on a negative about how low the rates are within some communities. And so part of the support and promotion is celebrating that breastfeeding is happening among African American and Native American communities while still taking time to address the historical trauma and some of the social determinants of health that influence the situation. And this data for this chart comes from the CDC. They're releasing a breastfeeding report card every 2 years. So I have a link here where you can find the full list and you can see what the rates are for your state. And I also have a link for an article from the CDC that talks about the racial and geographic differences in breastfeeding in the United States. So before we move on to specific resources, I wanted to touch on the fact that being able to improve breastfeeding rates boils down to improving access to information and support. So many mothers are interested in breastfeeding. Not just the mothers and fathers are interested in breastfeeding, and many families are trying, but we all have a role to play. So as we move on to talk about specific resources, just think about what role can you play, and we'll come back to that later. It's truly a community effort. So whether that's education about lactation, the process of lactation, what challenges there are, how to overcome them, making sure that our health professionals are knowledgeable about breastfeeding and know how to identify issues and know how to direct their patients to the right resources to get help. Looking at labor and birthing policies and practices, the messages that are coming through society, whether it's in media, from family and friends, parental leave policies, making sure that new parents have enough time off work to establish a good breastfeeding relationship, and then the workplace environment, making sure that there's proper support set up so that a mom can take the breaks that she needs and there are a space set up and places to store milk and things like that. So there are many aspects of breastfeeding support, and it's not just about what's happening within the family unit. All right, so next we're going to look at breastfeeding information resources. And the first resource is Medline Plus. Medline Plus is provided by the National Library of Medicine. It's their most popular consumer health website. It has 1,000 different health topics right now, and it has also information on dietary supplements, prescription drugs, different videos and tools to learn about your health, medical encyclopedia, health news, the Medline Plus magazine. You can also find links to different health organizations, or if you're looking for a local library where you can get more help with finding information, there's a directory of public libraries, academic libraries, hospital libraries that have identified themselves as being a consumer health resource. So I like to think of Medline Plus as a medical Google. Instead of going to Google, come to Medline Plus. And if you don't find a health topic page that matches whatever health issue you're looking for, you can still enter your search. There's a search box at the top of every page, and you can still search for your topic, and there are a lot of links within Medline Plus. So even if there's not a specific page dedicated to that topic, you can still find a lot of related links from nonprofit organizations, federal agencies, professional organizations that have been vetted by the staff at National Library of Medicine. So here's an example of a topic page. This one is on breastfeeding, but every topic page has a table of contents where you get the basic information. So there's a summary of the health condition. So here for breastfeeding, you have a summary of the benefits of breastfeeding. You have some basic resources to start with, some of the latest health news. Depending on the topic, there may be some diagnosis and test resources. And then you can get deeper into like research for like stats, clinical trials, journal articles. The See, Play, Learn aspect has different images, videos, tutorials, health check tools that are relevant to the topic. And then under For You, there will be resources for specific populations. So maybe there's a resource for men, for seniors, children, women, different handouts, PDF handouts that you can print out. They'll have those listed there as well. You can also get updates. On the right-hand side, you can see where you can sign up for updates. So if this is a topic that really interests you and you want to know whenever they add new information to this page, you can sign up for email updates. Medline Plus comes in English and Spanish. So if you see at the top right-hand side, there's an Espanol link. When you click that, the entire website turns to Spanish. And there are also certain resources that are available in over 20 other languages. So not every topic is covered by every language, but some of the most important health topics are. In addition to this breastfeeding topic page, you can also look up information either in the medical encyclopedia or through links for information on infant and newborn nutrition, tongue tie, breast infection, other relevant topics related to breastfeeding. So the next resource we're going to look at is called LACMed. The LACMed is geared towards healthcare professionals as well as parents who are breastfeeding. So it includes information on different drugs and chemicals that breastfeeding mothers may be exposed to, and also that can impact either lactation itself or the breastfeeding infant. So the information includes the maternal levels, so the level of the drug or chemical that would be in the blood, in the breast milk, potential effects in breastfeeding infants and lactation itself, compatibility of the drug with breastfeeding, and then alternative drugs to consider if that's relevant. LACMed was developed by a pharmacist who is an expert in the subject, and there's also a scientific review panel that oversees this as well. It's updated monthly. So here's an example. If I search for aspirin, so you can search by a brand name or by a generic name. It'll give me a lot of different information about aspirin, but what you want to narrow down on the left-hand side, there's a section called Drug Levels and Effects, and you'll want to look at effects in breastfed infants, effects on lactation and breast milk, and then alternative drugs to consider. You know, any drug or chemical that you look up, it'll be able to tell you that information, and it looks at what the literature currently says, so what the current research says, and it'll give you some brief information about the studies. So if some evidence has been found to support whether or not breastfeeding mothers should use a certain medication, it will give a brief explanation of what was found in the study. And if there is no evidence yet, then it will let you know that, you know, at this time, there's not enough evidence to say whether or not a certain drug is safe with breastfeeding. LACMed also has an app. The app is available for free in iTunes or Android Market. Similar to the website, you can search by drug name, so the generic or brand name. You can also search by the class of drug. And on the right-hand side of the screenshot, I have an example of what a search will look like. So again, I search for aspirin. And then you can see that you can select effects in infants, effects on lactation, for alternate drugs to find out the information on how the drug will impact breastfeeding. I received a lot of feedback. I recently exhibited at a breastfeeding conference here in Nebraska. I had nurses come up to me at the exhibit table, and they were so glad to see me sharing information about LACMED because they had a lot of great experience using the website and the app. And so there's a really valuable resource to use, and it's really great this is provided for free. All right, so Kelly Mom is the next resource we're going to look at. This is one of my top go-to websites for breastfeeding information, and I love it because it was developed to provide evidence-based information on breastfeeding and parenting. So it's very comprehensive and includes articles on almost every aspect of breastfeeding. So from preparing to breastfeed, how breast milk production happens, returning to work and pumping, introducing solid food, what to expect when breastfeeding during various stages of infant and toddler development, newborn sleep, and resources for transgender parents who are chest feeding. So the author of the website is Kelly Bunyata, and Kelly is an international board-certified lactation consultant and the mother of 3 children, and she writes most of these articles herself. So here's an example. How does milk production work? What I like about how she has set up her website is that she usually does include the author. So here you can see she wrote this article herself and she has her name right there. And then at the end of the articles, she'll include additional links. So you'll, under the See Also category, we'll link to other pages within her website that are relevant to that particular topic. The additional information section will look at resources from outside the website, so from other reputable websites, nonprofit organizations, federal agencies that have provided information relevant to the topic. And then the references section includes a list of all the journal articles or textbooks or whatever resources she used to write the article. So I love that she includes the evidence and a link to the evidence to support what she is writing about. So Women's Health, and this is another very comprehensive breastfeeding resource. The information is very easy to read, and it covers each stage of the process from making the decision to breastfeed, learning to breastfeed, overcoming challenges, pumping and storing milk, and breastfeeding in different environments, whether it's home, work, or in public. And there are also links to information from other federal agencies, professional organizations, and reputable nonprofits. And the articles on this website also include a list of references that were used during the research process. This site also comes in English and Spanish. So at the very top right-hand corner, you'll see the button or the link to click over to the Spanish version of the website. And then this website also includes additional resources such as infographics, Q&A, fact sheet, videos, and then there's a Your Guide to Breastfeeding. And so the Your Guide to Breastfeeding is about a 60-page booklet in PDF format. It could be printed out for free, or you can download it onto a tablet or e-reader. It has a lot of the basic information kind of condensed that's covered in the website and put into this guide. One of the things I like about the Office of Women's Health resource on breastfeeding is that they're very multicultural in their images. So it's very important for women to, when they have a resource on breastfeeding, to be able to see themselves reflected. And so the Office of Women's Health has done a really great job in their Your Guide to Breastfeeding of featuring pictures of families of different ethnicities. They also did a campaign a few years ago called It's Only Natural, which focuses on African American families. And so they have a section on the website called It's Only Natural, and a lot of their videos come from that campaign. But even though the videos feature mainly African American mothers, they can be beneficial to anyone. A lot of the information about making the decision to breastfeed, overcoming challenges, can be relevant to anyone of any ethnicity. And all the resources that are downloadable are freely available. One of the controversial topics in breastfeeding is breastfeeding and safe sleeping practices. So you may hear a lot of different terms, such as bed sharing, co-sleeping, room sharing, etc. So bed sharing and co-sleeping mean that a baby sleeps in the same bed as one or both parents. And room sharing means that the baby sleeps in the same room as the parents, but they sleep in a separate bed. The official stance in the medical community is that babies should sleep in a separate bed on their back with nothing blocking their face, head, and neck. So no extra pillows or loose blankets However, there are parents that choose to share a bed because that is what works best for their family. So it is important that parents have access to quality resources and know the pros and cons when making this decision. So in an effort to reduce the risk of sleep-related infant death, the American Academy of Pediatrics updated their policy statement and technical report late last year. And the report includes new evidence that supports the benefits of skin-to-skin care for newborn infants. It addresses the use of bedside and in-bed sleepers and adds to recommendations on how to create a safe sleep environment. So the AAP now recommends that babies share a room with their parents for at least the first year. They recommend that they have their own bed, but they're in the same room as the parents. They also talk about, babies should be on their back, no loose covers, no loose pillows, things like that. But one of the changes with this new policy is that they now recognize that parents do sometimes fall asleep with their baby during night feedings. I think in the past it was more of never sleep with your baby, and this is why it's dangerous. But now they acknowledge that it happens, especially if you're breastfeeding at night. So now they talk about how to create a safe environment in the parent's bed, and that includes the same thing, making sure that the pillows or blankets that are in the parent's bed are away from the baby, and that if you do fall asleep with the baby in your bed, that as soon as you wake up, you put the baby back into his or her own bed. For those parents, who do sleep with their baby, it's recommended that they don't, if you're under the influence of alcohol or drugs, and those include prescription drugs that cause drowsiness, definitely do not share a bed with the baby. So what I have here on the screen, the screenshot on the bottom right-hand side, how to keep your sleeping baby safe, the AAP policy explained. This is a easy-to-read version of the new AAP policy, or the updated policy, I should say. It's not brand new. And so if you want a quick and simple way to scan over the information and see what's there, this is a very condensed version of the policy document. Very simple and easy to read, and it shows you kind of the major points of the document. If you want to read the full report, I have a link to that as well, and it's called SIDS and Other Sleep-Related Infant Deaths and Evidence Base for 2016, Updated Recommendations for Safe Infant Sleeping Environments. And so this full document includes not only what the AAP recommends, but also all the research and studies. So they go through the different studies and talk about how those studies contribute to the different recommendations that they're making. So you can find the research to support their decisions in that document. For parents who still want to co-sleep with their infants, Dr. James McKenna of the Mother-Baby Sleep Laboratory at University of Notre Dame is considered the current leading expert on safe co-sleeping. So he has a website called Safe Co-Sleeping Guidelines. Talks about what constitutes a safe sleep environment and how you should prepare your bed and your room for safely sleeping with the infant, and in what conditions should you never sleep with your infant. So it's definitely important for parents to be aware of those resources when they're making this decision. So speaking of research, if you want to dig deeper into professional literature to research benefits of breastfeeding, co-sleeping studies, or the evidence for galactagogues, and galactagogues are substances to promote lactation, so like breastfeeding cookies or things like that. There's a little bit of controversy on whether or not those are actually beneficial or actually do anything. So if you want to research for yourself, I encourage you to use PubMed. PubMed is a free database with over 27 million citations for articles in biomedical and life science journals. So it includes journals that are related to breastfeeding medicine, human lactation, nutrition, dietetics, etc. And this literature is geared towards health professionals and researchers, so it's written at a higher level than the other, like kellymom.com or the Office of Women's Health website. And if you're new to using PubMed, on the right-hand side of the page under Using PubMed, you'll see a link for a PubMed Quick Start Guide, and also links to some very short PubMed tutorials that demonstrate different ways to use the search features. And for librarians, the National Network of Libraries of Medicine also provides a series of classes for you to learn more PubMed skills. So here's an example of a search. I searched for breastfeeding and otitis, which is the medical term for ear infections, and you'll see that I have a list of citations. So a citation is a record that includes the title of the article, the author, the name of the journal, and then an abstract. Most of the database is of the citations, so these records. So you'll be able to get a little information about where you can find where the article was published, and the abstract gives you the background of what the article is about. If you are looking to get the full text version, so to read the whole article itself, there are a few options. On the left-hand side, you'll see text availability. So if you just want to narrow down and look at the articles that you can easily get the full article through PubMed, you can click on Free Full Text. And if the article you really need is not available for free through PubMed, then I encourage you to reach out to your local library. If you have a library that focuses on consumer health near you, or a hospital library, or some academic libraries are open to the public, they can give you further guidance with how to access PubMed through their resources or journals through their resources. It's very important to know the breastfeeding laws for your state. And the National Conference of State Legislators has a web page on breastfeeding state laws. So in addition to the state laws, they also include the federal laws and links to more information about break time for nursing mothers and services that are covered under the Affordable Care Act. For example, if you're looking at your state laws, not every state has laws related to breastfeeding in the workplace. So there are currently 28 states, the District of Columbia and Puerto Rico, that have laws related to breastfeeding in the workplace. There are 17 states in Puerto Rico that actually exempt breastfeeding mothers from jury duty, or they allow them to postpone jury duty until after they're finished breastfeeding. There are 6 states in Puerto Rico have implemented development of breastfeeding awareness education campaigns. Then there are at least 3 states that have laws related to child care facilities and breastfeeding. It's important to be aware of what your rights are as a breastfeeding parent and how those laws are being enforced, or if you travel to a new state or things like that, and see how the laws are different. So for example, here in Nebraska, there was a law just passed this year that requires schools to have a written policy related to accommodating breastfeeding students with private and clean spaces to express breast milk during the school day. So this is a really great resource. There was another website called breastfeedinglaw.com that's maintained by a lawyer named Jake Marcus. That one I've seen also mentioned a lot as a good resource, but I was looking over it. They're still missing a few laws, so I'm not sure how often she updates her website or if it's something that she's still currently updating. But you may hear that website recommended, and it does cover a lot of the state laws, but I would definitely recommend this resource as the most current website at this moment. All right, so those are our information resources. So now we're going to move into our advocacy and support resources. So we've talked a lot about information resources, but there are also people resources. And this is a list of the different types of people who provide lactation support and advocacy within communities. So the International Board Certified Lactation Consultant is usually a health professional, but not always. They specialize in clinical management of breastfeeding, and they're certified by the International Board of Lactation Consultant Examiners. So if someone is not a health professional and wants to be certified as IBCLC, then they have to take a certain number of health and science courses in addition to lactation education. A certified lactation counselor is certified by the Academy of Lactation Policy and Practice, and they also provide evidence-based counseling for pregnant, lactating, and breastfeeding parents, and they have to take a 45-hour course and pass an exam in order to be certified. Community breastfeeding educators are usually people from their community who become educated about breastfeeding in order to reach out to their own communities. So usually a lot of nonprofit organizations or local breastfeeding coalitions will have some type of training program, and they will recruit people either have had experience with a breastfeeding parent or they're interested in supporting breastfeeding parents. And they have a training program they go through. It will vary from every community is different. They put together their own training, the community support. Peer counselors don't have to go through any training, and there's usually breastfeeding moms who have experience and they want to provide support to their peers. Oftentimes through the WIC office has peer counselors to support breastfeeding moms. There may be other nonprofit groups or community groups that start programs like this as well. The La Leche League is focused on mother-to-mother support. So they'll have support groups that are led by their requirements that the leader of their support groups has had personal experience with breastfeeding. Other community support groups could be more informal, where it's just a group of moms getting together, and others could be a little more formal, where there's some aspects of education involved in it as well. So ideally, parents should be making time to meet with an international board-certified lactation consultant before a baby is born, taking time to talk about things like breastfeeding goals, past experiences with breastfeeding, any chronic illnesses or ongoing medications that the mom is experiencing, and then their birth plans, because any or all of these could potentially influence the success of breastfeeding. So it's good to be proactive and troubleshoot to come up with solutions or additional support options. And then, of course, seek support after a baby's birth if there are problems. And any of these, whenever there are problems, any of these type of people that I have listed are beneficial. Usually the IBCLC is considered to have the most expertise. So if there's a really extreme problem, they're considered to be most certified, but CLCs are very qualified as well. For those of you who are librarians, lactation support people are excellent collaborators. So if you're looking at different type of programming that you can provide in your space, these are great people to provide support groups or breastfeeding classes in your communities. Breastfeeding coalitions are groups that are focused on promoting and supporting breastfeeding, and these are usually state or local groups, and they do advocacy, so they may work on policy and practice changes within their state or city governments, or policy changes within hospitals or healthcare systems in their communities. They provide education, so some of the coalitions provide online webinars, in-person conferences and seminars for breastfeeding families, but also for health professionals. And a lot of coalitions have resource pages, so they'll collect links of different websites or community resources for breastfeeding families. They may be involved in community projects, so they may be funding. So, for example, the Breastfeeding Coalition here in Nebraska provides funding for different communities to have projects to support training of community breastfeeding educators. And then research. Some of them do surveys to see the experiences of breastfeeding moms in their community, find the gaps and where their needs are not being met. Locally, our Breastfeeding Coalition did some surveys of health professionals to assess their attitudes towards breastfeeding and where they thought they needed more education. So this is a great resource if you're looking for local support and education for breastfeeding. So here's an example of a resource. The Nebraska Breastfeeding Coalition partnered with a nonprofit called Live Well Omaha, and they created a website called Really Really. And Really Really provides infographics, posters, and brochures on breastfeeding. So details on the benefits of breastfeeding, the importance of the sacred hour, which is that 1 hour right after birth when the mom and baby should not be disturbed and they should be allowed to bond unless there's some type of medical emergency. And then the importance of newborns being placed skin to skin with mom immediately after birth. So these materials, they're posters, brochures, infographics, and they can be downloaded and printed out for free. So you don't have to be a resident of Nebraska to use them. You can put them in health clinics, libraries, WIC office, a place of worship that shares health information, a community center. So other breastfeeding coalitions have similar projects where they either put together materials or created a directory of community resources. So this next resource is from the United States Department of Agriculture, and it's called Loving Support. And the Loving Support website provides brochures and handouts to educate community partners, parents, and families and friends. So most of the resources, the last update was 2008, but a lot of the information is still good. It's very basic information on the benefits of breastfeeding, how a family member or friend can support breastfeeding parents. So research has shown that the support of a partner and family is very important in helping to reach breastfeeding goals. And sometimes there is pushback from partners and parents because they see breastfeeding as a barrier to others being able to bond with the baby. Family members can spend time cuddling the baby. Partners can do skin to skin. They can bathe, diaper change, sing to the baby, read to the baby. These resources emphasize, number one, the benefits of breastfeeding so they understand why it's important, but also how to support a breastfeeding parent and how to find other ways to bond with the baby. So I really like these resources, and they're also very multicultural in the images that they use. Social media can also provide another avenue for conversation and support. I wouldn't use social media as the primary source of information, but there are some reputable pages and groups on Facebook that share quality information. There's also the opportunity to ask questions and get insight from other parents and lactation support. So if for some reason, I know especially here in the mid-continental region, there are a lot of rural communities, and so you may not have a local breastfeeding support group nearby. So being able to go online and join a Facebook group and talk about what you're experiencing and get some advice from others, it can be very beneficial. So these are just examples of some of the Facebook groups or pages that I follow, and I find that there's a lot of useful information. And the administrators of these particular groups do a good job of advocating for evidence-based information. So the Women's Health website, in addition to the breastfeeding resources for parents, they also have a section for employers. The Supporting Nursing Moms at Work Employer Solutions section of their website provides the business case for breastfeeding and also shares information on laws protecting nursing mothers. It also includes solutions. So a lot of times employers may want to be supportive, but they don't know how. They don't know how to create that separate space for a mom to pump milk or store milk, or they don't know how their policies should be changed, or they don't know how to accommodate break times or being a little more flexible in work schedules. So what I really like about this resource is that it shows profiles of different businesses and gives examples from a wide variety of industries. And it talks about what they did, if they had to spend money to create a space, how much money they spent, and different examples for how to accommodate break times and schedule changes. And so here's an example of a list of different industries. So anything from agriculture, construction, mining, retail, real estate, pretty much any type of job that someone would have, they can find some information on this website about how they can accommodate the needs of breastfeeding mothers. So I really like that they focus on the solutions. So this is great to give to a manager, but also for a nursing parent to take this resource and go to their supervisor with solutions already in hand for how they can be accommodated. And then those who are working will usually need child care, looking for resources to educate the child care providers on how to care for a breastfeeding baby. From what I could find, there was no one major national source, but it seems to be a lot of local sources of information. So if you're looking for something specific to your community, I would suggest starting with your state health department and your local breastfeeding coalition first. There are also some state extension offices that have resources as well. So I have an example screenshot here from the Colorado Department of Public Health and Environment, and they have created a breastfeeding and child care toolkit, and they have resources for child care centers as well as those who do child care in their home, and they also include a toolkit for parents and guardians for starting a breastfed baby in child care. The Kansas Breastfeeding Coalition provides training sessions for child care providers, and other health departments or coalitions have different campaigns, training opportunities, initiatives, directories of breastfeeding-friendly child care providers. So you kind of have to look around and see what's available for your community. But this is just provided as an example. I also have a link for an article called Questions to Ask Child Care Providers About Breastfeeding. So when you're looking for child care for a breastfed baby, knowing what to ask them in order to pick a good fit for your family. So we've looked at some of the public health issues related to breastfeeding. We looked at health information evidence-based health information resources, some of the community and online advocacy and support resources. And so now I want you to think about, what can you do? Because like I mentioned earlier, breastfeeding is not just an issue for the family or for the mom and the baby, but it's a community issue. The benefits of breastfeeding benefits all of us, and the ability for a family to successfully meet their breastfeeding goals, whatever those may be, depends on a collaborative effort of everyone in their community. So some of the things that can be done is providing evidence-based information. So if you're a health professional, librarian, a place of worship, faith-based organization, clinic, any place that shares information or resources, you can provide handouts to support breastfeeding. Creating a welcoming environment for breastfeeding parents. So if you manage any type of public space, looking at opportunities, if you have the space, to provide a separate room where parents can go to breastfeed if they prefer to breastfeed in private, or a place where they can go to pump milk, making sure that for those who feel comfortable breastfeeding publicly with or without a cover, that they feel welcome. Anywhere that a mom can bring a baby with her, she is by law allowed to breastfeed there. So having a welcoming environment where no one discriminates against breastfeeding families. Hosting breastfeeding classes or support groups or information sessions with lactation specialists. Providing space, as I mentioned, for nursing or pumping. Providing a supportive work environment. So if you're a supervisor or a business owner, making sure that you know the laws, the legal requirements for providing support, and just being able to work with nursing parents as much as you can. Social media campaigns, for those who do provide information by Twitter or Facebook, providing reliable health information related to breastfeeding, or using National Breastfeeding Month as opportunity to share images of breastfeeding moms. That's really powerful. As I mentioned earlier, for a lot of minority mothers, they don't see themselves reflected in a lot of the media about breastfeeding. So having taken the opportunity to share information, but also sharing images can be very empowering. Collaborating with community partners and advocating for better policies. So if you're working in an environment or you see an environment somewhere in your community that can be changed and improved, collaborating with others to advocate for better policies benefits us all. And then when we did our previous recording, some of the things that were shared, we had a lot of librarians there. So they mentioned creating a web page of links that they learned about today in this webinar, creating a resource guide, taking this information and sharing it with nurses and lactation specialists within their organization. So just think about what you can do to help support breastfeeding families in your community. So that is all I have for today. This is my contact information, my email, phone, and my Twitter handle. So feel free to reach out if you have questions about anything that I talked about today, or if you like help with finding a specific breastfeeding-related resource. I'm happy to take your questions. And then Annette wants to touch on some of the upcoming webinars.
Yeah, just a reminder that in just less than a month, we'll have a couple webinars coming up. Our regional one from MCR, Breathing Along with the RML, will be September 20th at 10 a.m. Mountain, 11 a.m. Central. And then the national-wide NLM resource picks will be focusing on the drug information portal on September 27th at 1 p.m. Mountain, 2 p.m. Central. And these are just a few of the many trainings and things we have going on, and you can access more of them by going to nnlm.gov/training. Or if nothing else, just do /MCR and you get to our regional page and there'll be a calendar link from there.
All right. Thank you all for watching the recording. And we hope to see you at future MCR webinars.
Thank you, Christian. This was wonderful.
Thanks for watching. This video was produced by the National Network of Libraries of Medicine. Select the circular channel icon to subscribe to our channel. Select a video thumbnail to watch another video from the channel.